welcome to the art of being human. We've gone over the body systems such as the lungs, the heart, the stomach, the head, the muscles, and the things that I've discussed in terms of how stress affects them. And I want to reiterate again the fact that you are a total person, and what affects one system will eventually affect all of the systems, because you can't feel good if one part of you doesn't feel good. If you are having trouble with your stomach, then you're going to feel lousy. And you may be thinking clearly, your muscles may be okay, you may be breathing normally, there's nothing wrong with your heart, but the whole thing is you feel terrible because you've got one part of you that feels terrible, and that carries on to everything else that you're doing. And remember too, people tend to define themselves by their medical conditions. It's like, yes, I'm so-and-so and I'm diabetic. So you're defining yourself by your illness or whatever condition you have, rather than just I'm so-and-so and I happen to have diabetes, but I'm not diabetes, I'm myself. And if you can separate yourself from your symptoms, that does give you some relief. You know, if you can say, well, I have migraine headaches. I don't, by the way, but just supposing that I did. If I go to people and say, yes, I'm Pat with the migraine headaches, you're talking about your migraine headaches more than you're talking about you. But if you can separate yourself from your symptoms, it's a help. I had one of my friends that had a stroke. I mentioned this once before. He was a good friend of mine. We'd met in a bookstore. We became friends. He was an elderly man. He had a massive stroke, and it was on July 4th, and I didn't live far from the hospital where he was taken. So I went up to see him, and his mind was clear, but he couldn't talk right. His speech was garbled, and he would cry a lot. And I finally said, Paul, I said, I know who you are. You're not your speech. I know I can figure out usually what he was saying, but I said, you know, don't define yourself by your speech. Define yourself according to who you are. You are Paul, my friend Paul. You have the same characteristics. You're the same wonderful person. You haven't lost that. You can't talk very well, but that's just a side issue. That is not you. Your speech is not you. It's something that you have, but it doesn't define who you are. And I described it to him in ways that I thought he could understand. And then after that, he started smiling. He got the drift. He's not his illness. He is himself. He has an illness, but he isn't the illness. If I have cancer, I'm not cancer. I'm myself. I have cancer, but that doesn't mean I am cancer. And it also means that I have a good chance of beating it out and not letting it take me down. So if you can separate yourself from your symptoms, then you'll be doing yourself a big favor. It's not always easy to do, though. Now, there's no such thing as a symptom without a cause. If you've got a symptom, anxiety, depression, whatever it is, there's a reason for it, and you need to know the reason. And so sometimes doctors will give medication to help, not necessarily just to help with the symptoms, but if you're going into therapy, you need to look at yourself and what's happened to you in the past. Where did this get started? Where did your symptoms get started? When did they get started? What happened to you? Now, we're not judgmental. We're not saying it's anybody's fault. We're not saying that it's the sufferer's fault either, the patient's fault. But somehow it got started somewhere, and it's good to be able to know what that is. Then we have a springboard to work with. And when you understand where it came from, you can get a handle on it, because now it becomes a rational thing. Yes, I am afraid of dogs because such and such happened to me when we had dogs, and I got bitten, and this happened, and that happened. And so you can gradually develop a pattern. It's not necessary, I don't think, to remember everything that's happened to you in the past, but it is important to remember a pattern of things that happened to you in the past, to give the therapist a chance to find out where he needs to go next in terms of counseling you so you can get well. Medication does help. It helps because it takes away enough of the symptoms so that you can dig in and find out what happened. I don't like to use the word dig in, but so you can go and get yourself involved in what happened to you in the past, and it'll keep you comfortable enough that going into yourself won't be so emotionally painful. If you're to look at yourself and what has happened to you in the past, especially if you've had an abusive background, it can be very, very painful. It can bring on more symptoms. As a matter of fact, you could become psychotic from it. So what doctors will do is give you medication to calm you down. So when you look at your symptoms and you look at your past, you're calm enough so it doesn't cause an adverse reaction, and you can find out at some point how this happened. What happened to you? Is there a pattern? Did it happen to you when you were a child? Did somebody abuse you when you were 3 or 4 years old? You're not going to maybe psychologically remember that. But if it continued through 5, 6, 7, and 8, you're likely to remember something. But you may have pushed it down, subconsciously pushed it down so you don't consciously remember it. So if anyone asked you, was you ever abused? Did anything happen? Your response is going to be, oh no, I don't remember any abuse. But the therapist, having all the training that they have, will know for sure that something's happened. The idea is to find it. Now, some people are anxious and nervous because they just are. It's a part of their nervous system. And it's not because they were abused. Not everybody has a past. But at the same time, they still need to know, how does this occur? When do I get it? Why do I get it? And how does this make me feel? What does it do to me? How can I stop it? And so the fight is on, so to speak, to find out where the etiology is, where the beginning is. And it may not be deep-seated. It may be that you had a bad experience recently and you're afraid of repeating that bad experience, and so you get your anxiety from that. The deep-seated things are harder to handle. They're harder to heal because they are deep-seated. And you've had years of covering it up so you won't remember it. The brain does not necessarily want you to remember the things that have happened to you that have been abusive or bad. And so therefore you have a fairly good dose of amnesia, only it's like a repression. You've pushed it down, and the brain has allowed you to push it down so you don't consciously remember things that happened to you. But even if you don't consciously remember the things that happened to you, your brain hasn't forgotten. It's not releasing it to your conscious mind, so you're not actively thinking about it. You oftentimes would say, well, if it was that bad, I'd remember it. But that's not the point. If it's that bad, your brain tries to suppress it so you don't remember it. And therefore, it makes you feel better because you're not facing it all the time. And this is what the defense mechanisms are about. And I think next time we meet, I'll go into those defense mechanisms, things that people do so that they don't have to face themselves head on when they have a problem. When the tension gets high, what do? Do you go for a smoke? Do you go for a drink? Do you go to the therapist? Do you watch a movie? Do you listen to music? Do you do your exercising? You know, there are things that people do traditionally to help them cope with the stress that they have. And the brain allows you and wants you to do that. It does not want you to remember all of the bad things that are happening. So the doctor gives you medication, the therapist, the psychiatrist will give you medication. If they're practicing with the ability to give medication, and that allows you to relax more and look at yourself and get to a deeper level of remembering. And then you start to remember things, and some of those things are pretty horrific, but you start to remember things. And once you start to remember things, the brain allows you to remember more and more and more until you have a picture of what your past was really like. And it may not have been like you think it was. It may be completely different than what you think it was, because through the years your brain has pushed down the bad parts and you don't remember them consciously. Because your brain remembers them, and because it has to be expressed, all emotions have to be expressed, then it comes out kind of sideways. You get the depression, you get the anger, you get the hostility, you get all of those things, and you don't know where it's coming from because it doesn't seem like like you, but your brain is helping you to express all the things that happened to you in the past that you don't remember necessarily, but that your brain remembers, and it gets expressed. So it's like a paradox. The brain doesn't want you to remember things that are too painful for you, and things get suppressed and repressed in your memory, and yet the brain wants those things to be recognized, because if they're recognized, then they don't have the power over you that they once did. If I realized that I was in a fire and I got burned, and I didn't know that before, then all of those scars that they have, I don't have to be afraid anymore. I don't have to have them hurt me in a way that's bad in terms of my relationships with other people. I don't have to go running away scared because somebody might notice that I have a scar or two, because the brain wants those things expressed, but in a safe way. And what medication does, if it's given, and it's not always given, it depends upon the person, what the issues are, so it's not a given that everyone's going to have medication. But if it's needed, it can be a big help in releasing those things that have been hard on you and have been difficult for you. So you can take a look at it and you can say, oh, so that's what it is. That's the first step in recovery, to realize what's happened to you in the past so that you can put a handle on it and say, oh yeah, I remember that now. That was awful. But I do remember that now. So now it doesn't have to have the power over you that it had when you couldn't remember it. It's like it was trying to be expressed. It was trying to be recognized. This happened. Look at me, deal with it. But you can't, because you can't fully remember it. So the brain lets the memory out, and you look at it, and you can say, oh yeah, so that's what it was. And then when you have that, it doesn't have to have the power over you. Now, there are techniques, and I'm thinking of happening as one of them. That is the word for it, happening, where you break that cycle, and you can get relief, almost immediate relief, without a lot of internal discussion, without a lot of digging up the past, and you can get relief. And I don't want to show you how to do it. I mean, I know how to do it, but I don't, because I'm not your therapist, and I'm not giving you therapy. I'm just pointing you in the right direction and explaining things to you and how they happen, because that'll help you to move on. But there are various techniques. That's not the only one. And it's not bad. It's not hard. It's not difficult to go through. And then you feel a lot better. The idea is to break that pattern of something happened to you way back, and now you're reacting to it, and reacting in a very difficult way. Make it easier. And so if you need the therapy, by all means, get the therapy. There are a lot of people that are trained that are really good people that can help you as you need it. So medication does help. And a lot of people, though, do self-medication, and they do it just exactly the wrong way. And that's what I want to get into today. Okay, so how do people self-medicate? What are they trying to do? Just take away the symptoms so they can function. A lot of people self-medicate by drinking. And it starts small. You have that glass of wine and you relax. Okay, I can face this now. I don't have a problem. And then you go back to being normal, whatever normal is for you. But then you have to have it again and again and again. And finally you have too much. And you start to get addicted to the wine. You get addicted to the alcohol. And you end up by being alcoholic. And so therefore you cannot do now without the alcohol, because you take the wine so you won't feel anxiety, and it works for a while. Then if you don't take it, then you have a lot more anxiety. So it's creating the symptoms that you originally took it for to give you relief. Now, the National Institute for Health has given a definition of alcoholism, and I'm going to read it off, basically word for word. This is what it says. It is a disease in which a person craves alcohol, is unable to limit their drinking drinks greater amounts to get the same effect, and has withdrawal symptoms after stopping alcohol use. Alcohol dependence affects physical and mental health. It causes problems with family and friends and work, and it's also called alcoholism. And that's the basic thing that I've been saying all along. You take a little, then you have to have more, because your body gets to tolerate it. If your body tolerates it, then you take the same amount. It doesn't have the same effect as it used to. It's not as effective as it used to because you're tolerating it so well. So what happens is you have to have a little more to achieve the same effect. And then you have to have a little more to achieve the same effect. And it's an ever-increasing amount of dosage that you have to have in order to have the same effect. And when that happens, you do become an alcoholic. Some people are more prone to alcoholism because their genetics are more prone to it. You know, some people can become addicted on the first drink. Most people don't, but some people do. But the thing is, even if you have a tendency toward alcoholism, no tendency toward any kind of substance abuse, once you start taking it, you're on a path. And you're on a path, and if you take more and more and more, which you will have to do to achieve the same relaxing effects because of the fact of the tolerance, then you will end up by being an alcoholic. Now, when you are anxious and you need relief, alcohol is effective in the short term. So are drugs effective in the short term, but you have to continually use it because your anxiety will continually come back. And this is the reason that I advocate for therapy, because once you get a handle on it therapeutically and you learn new coping skills and you learn what happened to get it started to begin with, then it doesn't have to haunt you. It doesn't mean you won't remember the events that hurt you. You will remember the events, but it doesn't mean that you're going to be haunted by them. They're like in the distance, and this is what I like about the Havening program, which, by the way, is a kind of a new therapeutic tool. It's not hard to go through at all, but it creates a distance so that when you think about what happened to you and how bad it was, it's like a distant memory. You remember it, but you don't have to have all of those deep emotional feelings and all that fear that goes with it, because the brain, when it records and when you tend to remember, you remember not only the event, but you remember all of the emotions and the anguish that went along with that event. And because you remember them, it's like it has a life of its own. It keeps coming back, and you keep remembering it, and you also remember all the horrible emotions that you had with it, all of the fear and the anxiety and the trepidation, all that you had to do with it. You remember it all. And so what happens is you decide that you can't stand it anymore, and you take the drugs to suppress. There are better ways. Some of these new methods are very effective, and they don't require years and years of therapy, and they create a distance. So when you remember it, you can remember it as a fact. Something happened to you, this was it. But you no longer have to be haunted by it. And if you're not haunted by it, you're not going to get anxiety reactions from it. The anxiety is going to be gone. So the more you use the alcohol and the drugs, the worse it gets. When you withdraw from alcohol, you get more anxious than you did before. It's part of the withdrawal symptoms. What about illicit drugs? People use illicit drugs to calm down. And the most common drug used, believe it or not, is marijuana. And the THC in it causes you to get high. That's tetrahydrocannabinol, but we usually just use the word THC in it. Now, it goes from the lungs. What happens with marijuana? It goes from the lungs into the bloodstream and then to the entire body. So every organ system in your body has marijuana in it, and you do get high. And when it gets to the brain, it produces a high, but other functions of the body are affected as well as you're taking marijuana. Things like memory, your thought processes, your concentration, your time sense is mixed up, your coordination isn't good, and you have sensory perception problems. And people say that marijuana is safe, and it's not. It's not a safe drug. I talked with one young man, and he says, well, when I'm driving and I've been on marijuana, I feel like I'm floating down the street. I'm like 2 or 3 feet in the air, and I'm just floating down the street. Now, if I'm driving my car, I don't want to meet a person who thinks they're floating down the street, because if they're misperceiving everything, they could be misperceiving their distance perception. They could decide to do something that would really cause harm to themselves and other people. So it's not a safe drug. Now, there are other forms of marijuana that are used for medical purposes that are very legitimate uses for medical purposes, and it doesn't make you high, but it does make you better, stopping seizures, stopping pain, and things that are very helpful when other medications sometimes don't work. But you have to remember, to use it as a pleasure thing, to use it recreationally, means that if you get too much, you can go into all kinds of problems. You can be hallucinating on too much marijuana, just like you can hallucinate on other kinds of drugs. So it's just not a safe drug to use. So you can get dependent on it. And when you try to get off from marijuana, you're going to have withdrawal symptoms such as greater anxiety, irritability, decreased appetite, disturbances in your sleep, and possibly depression. It's dangerous to use when you're driving, but marijuana is not the only drug that is used in order to self-medicate. Other drugs are used as well. The amphetamines, heroin, ecstasy, all of those. Now, I just finished a whole segment on different kinds of drugs and their uses and their misuses, so I've gone over some of these things before. These drugs do not decrease anxiety. They seem to in the short term, but when you get off from them, they increase anxiety. And this increased anxiety causes panic reactions and paranoia and rapid heartbeat and all kinds of things like that, and even insomnia. So I think I'll close it here, and next time we'll start with prescription drugs. How do people misuse prescription drugs? These drugs were illicit that I'm talking about, but now next show I'll go into prescription drugs. So we'll close it here, and please join me next time.